Hundreds of students and staff at Auckland's Marist College are being offered Covid-19 tests in a bid to reassure the community. 94 people connected with the school have tested positive for the coronavirus, making it the country's second largest cluster after the Bluff wedding. Mackenzie Smith reports.
Of those connected to Marist College who tested positive for Covid-19, all but 8 have recovered, and there's only been one case from the cluster reported in the past 2 weeks. Auckland Regional Public Health Service Director Dr. William Ranger says the virus probably isn't circulating and the testing is about providing assurance to the community.
So that's to staff, to students and to the families of students that there is no virus circulating amongst those people before they go back to school at some stage in the future.
This week, all 750 Marist students and about 70 staff are being given vouchers that will enable them to get tested. While the testing is voluntary, School Principal Rochelle Taulu encourages everyone to be tested regardless of whether or not they're symptomatic. At today's media briefing, the Director General of Health, Ashley Bloomfield, commended the offer.
While only half of the 94 cases associated with the Marist cluster were directly associated with the college, the others were a result of transmission within families or to others in the community. It's important that the wider school community is given the opportunity to be tested.
When asked today if the Marist College testing could be applied to other clusters, Dr. Bloomfield said in some cases it already has been. He says an aged care facility, a Hawke's Bay holiday park, and with some individual cases, testing has been offered to non-symptomatic people.
For the last 2 or 3 weeks, we've been advising on and working closely with the public health units about quite wide testing of asymptomatic people. Justin and I talk about this notion of putting a wide ring fence around these clusters, and particularly in the ARC settings, but it's also been used with some of these other clusters as well.
Dr. Bloomfield says he's looking forward to seeing how much uptake there is for the testing. For Checkpoint, Mackenzie Smith.